So you do have training and experience in a bunch of different modalities. As a therapist, how do you think about what approach might be best for a new client as you're getting to know them?
Yeah, it's such an important question. Yeah, I'm trained in Gestalt, in AEDP, EMDR, and some somatic experiencing. And again, they're all somatic based therapies. And I like to integrate my approaches. So generally, when I'm working with a new client, I usually start with AEDP and Gestalt. Because these modalities really help me assess, how a client is able to take in the somatic approach and also benefit from our relationship. Because I really, the way I work is I really believe that our relationship is one of the main recipes for healing. And so what I'm looking for is, is this person kind of able to drop into their body with my support and access deeper emotions that kind of help them get underneath their symptoms and find some relief. And for some people, it's really supportive using the Gestalt and AEDP somatic approaches. And then for some other people, I notice there are specific stuck places or like traumatic holds, and that deserves a specific kind of trauma-informed approach. And in those situations, I might engage in EMDR. If there's like a specific memory or kind of way that they're in their body that keeps on getting activated, we can use EMDR to really specifically address a trauma pattern in their body. Yeah, and then for some people, they come in and really their thoughts are racing so quickly. It's so hard for them to get out of their heads, even with some of the approaches. And with those folks, I'll use specific interventions, parts work to really help them address like negative core beliefs or like self-punishing thoughts that are really blocking their access to feeling. And that might take some time to do that. So, and then I'll use somatic experiencing, especially with clients who often feel like emotional flooding or overwhelm when they're in session, because there are a lot of somatic experiencing techniques that help someone better regulate and soothe their nervous system response during and in between our work. So that's also a nice tool to use.
Yeah. And it's like there are different needs. There's processing things. There's regulating and grounding, right? There are lots of different needs that people come in with, and there's sort of repetitive behaviors or particular ways of coping that might need to be worked through before you can go deeper, and there are different approaches that kind of work with all of that.
Yeah, exactly. So I'm sort of seeing like, where is the client right in that moment, and what's the best modality that will support them with where they're at.
Yeah.